here at THUAS. So give her a big round of applause so we can start. Thank you.
Thank you. Good afternoon. As Elisabeth already told us, Lampros is not only part of the Faculty of IT and Design, but he is also a member of the Center of Expertise Health Innovation. So I will tell a little bit more about the Center of Expertise and Lampros' role in it and the role of data science for public health and healthcare. In our Center of Expertise, we focus on developing, evaluating and implementing social innovations and technological innovations to improve the health and the quality of life of our residents. And we focus, Lampros already showed it as well, we focus on 3 themes: prevention through nutrition and physical activity, inclusive physical activity and sports, and long-term healthcare, housing and welfare. And we think by using data science techniques, AI, we can accelerate progress, as Lampros told. We can improve the impact of our work and finally improve the health of our residents. In our Center of Expertise, we have 9 different research groups, all focusing on these 3 themes and eventually the positive health of our residents. And data science can be used in many ways, for example, to screen or diagnose for certain disabilities or diseases, as was shown in the example of skin therapy. It can be used to predict or detect target groups or subpopulations that are at risk. We gather a lot of data, and it can be used to predict or detect them earlier and give them a suitable intervention or treatment. It can be used to monitor trends and progress, to select the most suitable intervention and not use a one-size-fits-all approach, but make data-driven decisions, but also very important value-based and ethical decisions about which treatment or intervention is most suitable for that person. It can be used to evaluate interventions in a smarter way than mostly done, and to benchmark, to compare between neighborhoods or schools or hospitals, and to see what can be improved. Some examples, when we look at the 3 teams of our Center of Expertise, well, there are many purposes and many questions we have in the research group and from the partners we collaborate with. For example, you can think of improving the methods to assess dietary intake. I think we all know that self-reports, well, just show part of the reality. Many people do not know what they exactly eat or the amount they eat. So it would be wonderful if we can use images, pictures, photos, and, well, estimate based on pattern recognition or imaging techniques, how much they eat of which product. And then, well, give them advice or detect the most suitable intervention. Or to train models, for example, that predict which children are at risk. We are gathering a lot of data about the motor skills of children in our center. And it would be wonderful if we can detect them earlier and help them well, to overcome their problems and not underdevelop the motor skills. Or we gather also a lot of sensor data from top sport athletes or also wheelchair top sport athletes. And can we identify, this is very rich data, and can we identify data patterns of movement and improve the wheelchair design or the way they train to improve the performance and also the health of the wheelchair sport athletes. But you can also think of a dashboard for healthcare professionals and remote care and really use the data from smart devices, from heart rate monitors, and help the healthcare professionals, but also the patients to make data-driven, well-informed decisions. So in my opinion, it's not, we should not only think of personalized medicine and treatments, personalized treatments, but also think about personalized prevention and diagnosis. Nowadays, most of the time we just make a difference between male, female, age groups. Sometimes we take into account the weight of people, for example, if you think about medicine, the pills you take. But there's much more data we can use to make better, well, to improve the health, but make better decisions. And we also, if we gather that data or increase our insights, we should also think about the changing role of patients, and we want to, well, adopt the knowledge we are gaining, not just in the Bachelor of AI and Applied Data Science, but also in the bachelor programs, the master programs of our future health professionals. And then we have to think about, well, the fair data principles and the ethical issues related, but also about the changing role of patients. Nowadays, part of the patients are more proactive and well-informed, but we also should think about the people, the patient with low digital skills, low health literacy skills, especially in the neighborhoods we are working in. But we also should think of the digital skills of our medical students, our healthcare professionals, and also of the teachers. So it would be wonderful if the knowledge gained in this research group can be applied to the different educational programs in our university. So I'm very happy with your research group, Lamplos, and also the researchers involved. And I think we can really, well, improve the impact and work on the health of our residents. Thank you, and congratulations already on your speech you had. Thanks.
Thank you. Thank you, Sanne. If you please